Welcome, everyone, to the Relay. I'm your host, Val Emmons. And today we're joined by two national leaders shaping care quality and transitions across healthcare, and both proud board members of ABQAURP. And I want to introduce Dr. Natasha Chen, who brings over 16 years of leadership experience, including 13 years as a physician advisor, which is what we're going to be talking about today. Her course that she and Cheri Lattimer are working on for certification for a physician advisor. They both are nationally recognized, and Cheri advocates for improving care transitions and reduced readmissions and strengthening transitions of care. She is the executive director of Intuck. But they offer a powerful perspective on the evolution and future of a physician advisor role, because I was not aware of some of the things that actually I wasn't even aware of what the physician advisor does in this day and age. And Natasha, do you want to kind of introduce yourself, and then I'll let y'all introduce yourself a little bit and to the audience. That way they get an idea of who you are.
Sure. Thanks, Val, for having me today. And don't worry, you're not alone. You're not the only person who does not know what a physician advisor is or does exactly, because it is something that is not, well, it's not new, but it's relatively new. Just to introduce myself. My background is that of an internal medicine physician, and I worked as a hospitalist for a number of years and became a medical director in that field, and then made the switch to become a physician advisor and have been basically in the physician advisor field since then for more than a decade, as you said. And I've been doing a lot of different roles as part of being a physician advisor. And, we can talk about the evolution and the types of roles that physician advisors do in hospitals and healthcare systems. But yeah, that's basically my background.
Cheri, do you want to give a little bit? I know who you are. Would you like to let everyone else know who you are and what got you into helping craft this certification for the physician advisor?
Oh, I'd love to. I am a clinically trained nurse, and I have been working in all areas around nursing transitions, case management, documentation, utilization management, and review for most of my career. Although I will say I spent the first 18 years practicing with a general practitioner in primary care, but that has just really, I think, rounded my whole vision of healthcare and the pieces that often are very siloed and how they might be able to work together. Within that process, though, I have spent the last, I think now 7 years as a ABQAURP board member. And for those that don't know that term, ABQAURP, that's the American Board of Quality Assurance and Utilization Review Physicians. And on that, I have become very aware of the really important role that physician advisors play. And as we talk today, I really want to share how I see that role expanding over these next few years with the movement of value-based care and payment models that CMS is bringing forward, and how important their role in working with teams, not only in an acute care setting, but in a commercial health plan and in the long-term care setting, and how we can really support that patient's journey through that.
So, for listeners new to this space, well, we kind of wanted to define actually what a physician advisor in today's healthcare system is, and what gap was this role originally created to fill, and does that still hold true today for that role?
Sure. Yeah, that's a great question. So the original gap was basically utilization review. And this role originally started, usually called a medical director of utilization review, for the reason that hospitals needed help with determining what status a patient should be in. Should they be an inpatient or should they be an outpatient? And outpatient meaning an observation or, getting an outpatient surgery, for example. And that's really how it originated. But since then, and it has evolved greatly. And it used to be that a physician advisor might be a side gig, if you will. It might be somebody who was already on the medical staff, who the case management department could run to and say, hey, what do you think about this case? Could you look at, these few cases for the week and tell me, should this patient be admitted or should they be in observation? Or it might be a smaller subset of what maybe a chief medical officer or a vice president of medical affairs might do as part of their overall job duties. So it has really evolved from being kind of that type of a role to something that has become more comprehensive, more widespread, and a little bit more, I guess, integral to the way that a hospital is run in a lot of different ways. So that is basically where it started, was in the area of utilization review, but it has grown tremendously since then.
Cheri, is that how I know you've been in this a little bit longer than Natasha, so is that how you see that position has evolved? Because in my perception, when I heard the term physician advisor, I was thinking this is a person who advises the doctors, not in terms of, your inpatient or outpatient or things of that nature, but I was just like, they tell a doctor what to do. Okay. They advise them when they have a question like that. That was I had no idea.
Yeah, that's not quite the role that we see as a physician advisor. And I think that my true interest in this, and really a lot is positive involvement with Natasha through this process, is that the role today that we see and that we're actually supporting through educations and certification is an interaction, not with a physician to tell them how to treat the patient, but to help them understand some of the things that are built into patient admissions and the discharge process and the transition to care process, how to coordinate that and how to understand what that means, not only between documentation and, as we all know, various criteria that guide us on a hospital stay, but how to really explain various aspects of that to the team, to the patient, and to the family caregiver. I see this role as being really, really important. And physician advisors today, I think, are just a key part of clinical care team that often sit down to discuss the patient and the next steps for that patient and where they need to go. I also think, and Dr. Chen, please just correct me if I'm wrong on that, they really help us in a lot of ways to understand the correct documentation, which is very necessary for referrals, for any type of procedures, for approvals that we need, and to keep us on a steady track of good patient care, safe patient care, and quality patient care.
Yeah, I agree with you. And one of the things that physician advisors are known for is being a liaison and a great communicator and a resource for, different hospital departments, especially case management and clinical documentation departments, coding and billing, for example, and even the quality department. So a lot of the things that you mentioned as far as moving care along, care coordination and transitions of care kind of fall into those areas. Physician advisors are really capable of speaking the language of each of those areas. They have to be comfortable with physician outreach, sometimes having uncomfortable types of conversations, crucial or critical conversations, sometimes unpleasant conversations. So you really do have to be a great communicator, not only to physicians, but also with the administration and also with payers, the third-party payers, or the insurance companies. So physician advisors basically speak the language of each of those departments, and so they can communicate very well. They're also a huge patient advocate. So their focus remains on high-quality patient outcomes and on patient and family-centered care that's delivered safely and efficiently. And they do this through a lot of different ways. So through ensuring the appropriate level of care, which is what, we started off this podcast with, is talking about utilization review. Yes, that's ensuring the appropriate level of care. We want to make sure the patients are in the right status, and that impacts coverage, like you said, and also access to services. And they're also a big component of managing and handling denials. So, insurance companies, if they deny a hospital stay for lack of medical necessity, physician advisors are there basically almost every step of the way. They are looking at the medical record. They are having a peer-to-peer conversation with the medical director. They're talking with the attending physician if they agree with the denial. So They're really focused a lot on denials management and handling the ever-increasing number of denials that are coming in today. And then, of course, Cheri, case management and coordination, reducing avoidable delays, optimizing length of stay, reducing the risk of, say, hospital-acquired complications, and just making sure that care is progressing, that the patient's not staying in the hospital, not getting care, and that when they're ready to go, that they have some place to go to. So those are all things that they do.
But this isn't someone that the patient even knows is in their corner, or because I'm not clinical, so I would have never known that. Is this someone a patient can reach out to?
So not in the traditional sense. There's very little interaction between a physician advisor and a patient, although it can happen. I mean, I know of physician advisors who were willing to go talk to patients when they were, say, upset about the status they were in. They were placed in observation and they were wondering why they couldn't be an inpatient. But I would say that that is very rare. I also have had experience and have myself and also have known physician advisors who are willing to attend family meetings. So if there was a family meeting where there was a very difficult discharge decision to be made, the physician advisor in some cases could sit in on the family meetings and discuss with the patient directly along with other members of the care team. But this is not somebody that a patient will interact with, see, or talk to. However, there is a lot of discussion that a physician advisor will have with the care team, particularly if they are involved in multidisciplinary rounds, which basically is where there's a large group of people from different disciplines, in a room together discussing about a patient's care.
So, Cheri, I know you talk a lot about teams. So would you see this role as physician advisor on that care team that we talk about all the time for transitions of care?
Yeah, I think sometimes the title just physician advisor, we kind of put the physician that is in this role in a box, thinking, well, they're just working with the physicians. But in reality, they work with the full clinical care team. And when you truly think about it, this particular physician has to have a broad knowledge of all aspects of healthcare, just not in the hospital at the acute care level, because the physician advisor is also involved at looking at the discharge transition plan for patients. So understanding the care coordination and what is available in the community and to help the care team be able to work through that. We also expect physician advisors to really understand regulatory compliance. And so when you start looking at all the different skill sets that we ask a physician advisor to do, it is way beyond just looking at a patient and are they in the right place at the right time. It is really communicating across the teams, sometimes to the payer, as Dr. Chen said. Sometimes it's beyond that with the family and difficult situations, but it's really being able to pull a whole picture together for them and to guide them along this journey. And I see it as one of the most valuable positions that we have in care coordination today. And I honestly believe that's why I was so dedicated to really helping and working on creating the certifications for this role, because I think their skill sets are great and they need to be recognized for what those skill sets are.
So is this the first certification out there for a physician advisor role?
So this certification is a relatively new certification. It came out at about, let me see, we started working on the exam in 2023, and then we completed it in 2024. This is a board certification, and it is for the advanced physician advisor. There are other certifications available. This one, however, is an advanced certification, and there are 6 major topics within the certification exam. And we have also developed this new core body of knowledge for the advanced physician advisor, which has the basically preparation required to take this test and to be familiar with the topics that are on it. And, the categories include things like Medicare compliance and regulatory obligations, quality measures and metrics, case management, coordination, clinical documentation, integrity, utilization review, and leadership ethics and regulatory guidance. So Cheri pointed it out that it's a very broad range of things that physician advisors are now responsible for knowing. And this course really covers everything that a physician advisor would need to know about their job and how to perform it successfully. I mean, there's so much terminology, there are case examples, there are scenarios that you can read about, just really in depth, great examples of what you will encounter if you want to become or you are a physician advisor. And the other thing I want to say is that you may think that you know that topic already, but it will reinforce the things that you know and it will add on to it, and then you will learn something new. I mean, there's just so much information within this course. It's 11 credits of medical education within the course, and it will prepare you for this board certification as an advanced physician advisor. And you might see the letters behind the names of certain physician advisors that have it, which is the CPHYADV, and that indicates that they have been certified as an advanced physician advisor.
What is there a prerequisite to taking the certification? Like, do you need to be a doctor or?
Yeah, so to be an advanced physician advisor, yes, you do need to have a degree. So either an MD or DO, a degree in medicine. And you also need to have worked a certain number of hours in any field related to physician advisor work. You need to get letters of, you have to put down 1 or 2 references as part of the application process. So basically that's it. The education requirements, you do need to complete a certain number of hours of educational requirements to be able to sit for the exam. So already you're going to be experienced and you're going to have the education necessary to take the exam before you even sit down.
So, Natasha, let me just ask you, because we do know ABQAURP has a previous physician advisor certification. Is that a career ladder build, or can you go directly to the advanced certification without having the previous physician certification?
You can do either. So I actually started with the first certification, which is the CHCQM, Certified in Healthcare Quality and Management. And then you can obtain those specialties certification as a physician advisor. And so that is, in your words, the kind of the ladder that you can take, is you can begin with that more generalized sort of basic physician advisor certification. And then the second one, this new one, is for the advanced physician advisor. If you've already been a physician advisor for 5-10 years, you could probably go directly to this advanced certification without having to do the first one if you don't have it already. But if you have the original one, then you just have to do a little bit more as far as CME requirements, the continuing medical education requirements. You need to reach a certain number of educational credits, and then you can sit for the more advanced exam.
If someone were to ask you, why should I get this? I'm already doing this. I know you said that there's a lot of information, and we wouldn't need certifications or anything if we knew everything, of course. But what are also what are some of the things that y'all found that really surprised you about this role?
Well, the reason why one should certify is because it really does validate your expertise, and it also demonstrates your competency. You're going to be forced to stay up to date. You're going to be forced to be committed to your field of quality, the field of quality and compliance and safety and just everything that goes along with that certification. So that in itself should be reason to get the certification. And of course, it can lead to career advancement. So it will basically make you stand out. It's a competitive field. A lot of people want to become physician advisors. Physicians are getting burnt out. Some of them are looking for a way out into a role with more regular hours and not necessarily having to work weekends and nights. So, so those are the reasons why you should certify. Do you have anything to add, Cheri?
No, I think certification is that valuable tool that does validate expertise, and we see that in all fields. And I have always felt strongly that physician advisors, for the important roles that they have, that they work in, should be able to show a certification and should be able, and actually should be very proud of it. And I am proud of the advanced physician advisor certification, because for the first time, we really did bring in the discussion with them not only about the care at the acute level, but that transition that has to occur. We talked about coding beyond just the coding in the hospital, but codes available to help with transitions like the TCM and the CCM. And I think that and it's just my humble opinion, but I think it's a great prep course. I was going to say jumping board for what we're seeing coming down with the increased value-based care and value-based pay models by bringing all that together within the exam that we have. And I think it's a wonderful role for physicians. And I'm going to ask Dr. Chen, just talk about because we do have physicians looking at this role, and we've talked a lot about the job, and you brought out some of the positive things around just moving basically from a full clinical into clinical and administrative with utilization management review and now transitions. What do you tell a young physician considering that, or a physician that's been in the role for 15 to 20 years about that position to encourage them to move forward, Dr. Chen?
Well, it's a big step. And I will not sugarcoat the fact that you have to be ready to make a very major career change. It is something that you can't really prepare for aside from reading about it and maybe shadowing a physician advisor, because every day is a little bit different and you can't really anticipate how things are going to change. Regulations change, priorities of the organization change, and you may be asked to do things that you weren't expecting. So I think the word of advice would be that get ready for a big career change. You're going to be working hard. It is not a career or a job that, oh, I'm leaving clinical medicine, this is going to be so much easier. No, that is not the case. You will be working hard. You will be faced with challenges. You will have difficult days. There will be difficult conversations. And that would be my advice for somebody new and somebody old.
And it sounds so familiar, to be honest, as we've worked for years in case management. And so many nurses think that leaving the clinical field and becoming a case manager is going to be an easier role. And it's not. It's literally expanding your knowledge and your ability to coordinate and communicate beyond what we often see in that clinical, plus what a case manager really has to understand about the community resources besides the hospital resources and the post-acute resources. I see these two positions as being very critical in working together to really support patients and their family caregivers along the patient journey of the healthcare continuum.
Yeah, it really is a whole new world. It is a different world of medicine, of healthcare than what you're going to be used to when you leave the clinical world. You're going to be dealing with a lot of regulations. You're going to be dealing with a lot of updates. You're going to be dealing with laws, compliance, all sorts of things. I mean, I started off as doing basically just medical necessity reviews, looking at inpatient and OBS. And then all of a sudden, all these things changed, like the 2 midnight rule. That was something huge. That was like ground shattering, whatever you want to call it. At the end of 2013, that really changed the way that we looked at the way admissions are handled, the 2 midnight rule. And then other things happened along the way. There's the inpatient only list, procedures being removed. For instance, the total hips and the total knee replacements that are elective were taken off the inpatient only list. And now you had to educate just an entire medical staff on how to handle that and how to document. Cheri, you were mentioning documentation. This is something that the physician advisor is integral in. It is making sure that the doctors document basically the medical necessity so that the hospital can get paid what they deserve. And then there are other things too. I mean, you're going to be on various committees. Physician advisors are routinely expected to be on utilization management committees, the committee/UR committee. That's what they're known as. And they will be making decisions on those committees. And then you're going to be working on things like quality initiatives. You're going to be looking at readmissions. You're going to be looking at, those that are preventable and not preventable, having to sort through those. And then, of course, you might have to, if you're on the rounding side of things, Cheri, with the multidisciplinary rounds, working with the hospitalists or whoever your admitters are for the hospital system and working on all of those things. Yeah, it has really, really changed and diversified over the years as far as the roles that a physician advisor are responsible for.
I couldn't agree more.
So basically, you're going from being the doctor, the on hands guy that does the doctoring, being a physician, to being part of the administrative team, basically.
Basically, that's what it is that you're now, when you're working as a physician advisor, you cannot really cross the boundary and start treating the patients that you're reviewing. So that is a kind of a red line where, if you are reviewing a case, you can't also be a clinician on that case. So, a lot of physician advisors, for that reason, they stop practicing when they become a physician advisor, or they very clearly will delineate the time that they are clinical. And then when they're not clinical, they are the physician advisor.
So, do you think this role is reached maturity, or is it still going to evolve? And like, what's missing if it hasn't completely evolved into what it's going to be when it grows up?
Well, I think it continues to evolve with time. I think that as the payment models for healthcare change and as value-based care becomes more and more important and widespread, by 2030, I think every Medicare patient will be involved in some form of value-based payment program. So I think the role will continue to evolve, and we'll be looking at things more and more like population health and basically bundled payments and basically care for quality. So that's sort of where it's all going now. We'll still be doing the same things. We'll still be doing utilization review. We'll still be doing peer-to-peers. We'll still be doing clinical documentation improvement and maintaining integrity and looking at things like hospital stewardship and not wasting resources. We'll still be doing all of those things, but I do think that there is room for continued, growth and evolution within the role.
So, Natasha, do you see a role as we move on in these next few years of where AI could have an impact in some of what our physician advisors are doing?
So, and AI is already being used a lot in utilization review. AI is really great at going through large amounts of information and honing down and summarizing it. And essentially, that's what a physician advisor would have to do when, say, they were working on a denial. They would have to go through an entire medical chart, and medical charts, as you know, can be just pages and pages and pages, going down, scrolling down. And that's what a physician advisor would do, is they would pick and choose the important parts of a medical record to present to a payer medical director to try to overturn the denial, looking at things that would demonstrate that they were extremely ill, that there was severity of illness, that there was intensity of service, for example. And they would be able to pick these things out fairly quickly, looking at everything. They're in there from the ED presentation to the discharge, the vitals, the labs, the studies, the consults, everything. So AI can do that very, very quickly. And it can also pick out, give a lot of data, constantly refresh. So, with data every so many minutes or up to date type of things that maybe somebody wouldn't be able to look at a chart maybe just, once or twice a day. They could provide updates. AI could provide updates every few minutes. So yes, I think that AI is something that could be very helpful.
So I always think that AI is a great tool, but it still needs a human look or touch. And I can see where the physician advisor might be part of that team that has that overview. As we all know, if we use Chat GPT, it can come up with a great outline, a great story, a great journal article, but we do have to go back in and check the references, make sure it pulled the correct. And we do know that in using artificial intelligence is the correct data has to be in to get the right data out. So I'm not sure that I don't see a physician advisor having a role along that line also.
Yeah, I definitely would not recommend that anybody rely on artificial intelligence to diagnose themselves or to make decisions on whether or not a hospital should be paid or not, or any number of things related to medical care. Definitely, you need somebody who has real life experience. They have a medical degree. They've had 40,000 hours of training, they say on average, that a physician does before they even start the job. AI may not be able to pick out all of the relevant things. They may not be able to connect the dots, so to say, as to what an insurance company uses for medical necessity, because they may not know exactly the criteria that health insurers use. But a physician advisor will have a very good idea of what they need to say and what they need to look for in order to connect those dots.
Yeah, I could because you have to remember the doctor is ultimately and the hospital or the clinic, the system's accountable. Even when using AI, who are you going to hold accountable? You can't hold AI accountable. So you need to remember that whenever anybody is out there using AI to come up with a care plan or something in that nature for a patient, because ultimately you can't sue AI. You are responsible. So make sure it's right and have a human part of that.
That's right.
I am a firm believer, and as I know Natasha is too, the physician role is a very important role. It's advocacy for patients and it's advocacy for the clinical team is, something that is so important. That certification helps to identify that they have those skill sets. I actually do think it's kind of sad that patients and families in the hospital don't know they have that type of an advocate that is on the team. And Natasha, do you ever see a time when hospitals might see this as something that they can even promote for both the quality of their hospital and of the care they promote to patients by having such a skilled individual as a physician advisor and an advanced physician advisor working with the team?
Yes, absolutely. I do feel that the physician advisors' roles should be highlighted. And basically, what the hospitals can say is that they are committed to quality and safety and to efficiency, to reducing claim denials for unnecessary care, for ensuring compliance, and also for optimizing best practices through evidence-based guidelines. And what a patient maybe will understand a little bit better is that the patient will get the care that they need, but nothing more extra than that. They don't need to receive unnecessary utilization of services, and everything will adhere to national standards. And like you said, physician advisors really are there to advocate for patients and make sure that they're getting the best care possible, that they have a really great experience while they're there. They want to make sure the medical records are accurate, the documentation is accurate, and they're really experts in reviewing the chart and helping with all of the things that will support receiving just the best care possible. I think by showcasing the physician advisor credentials, the fact that you have an advanced physician advisor working within the hospital, I think that would be great to put in maybe some marketing materials or on your website or on a brochure, just to highlight the fact that you have physician advisors and that they have this advanced board certification.
How deep does this certification go addressing real world transitions of care challenges like readmissions, handoffs, post acute coordination, the discharge planning? How far does this one certification go with that?
Well, I think that the certification really helps to hone in on making sure that we bridge the communication gap between providers, between case management, between patients, their physicians that they're going to be following up with in the community, making sure that the handoffs and the documentation is there, that they're in the right setting, if there are any barriers that they're identified, and just making sure that the patients are getting the services they need once they're discharged from the hospital, for example. And also, as far as, readmissions, the hospitals right now are really good at identifying patients who are high risk for readmission. I mean, case managers are really good at looking at those types of patients. And there are penalty readmissions where there's a financial penalty if, breach a certain goal. And so this is something that hospitals are very, very interested in. They don't want their patients, for many reasons, to have to come back to the hospital. Physician advisors really are well situated to be able to help with those types of readmission reduction initiatives by basically seeing if anything, if the ball was dropped in any way. They'll be looking at the readmissions, what happened during the last stay, is there anything that could have been done better? And then working with the case managers on the transitions of care to try to prevent that from happening again.
Sherry, would you like to talk to that question a little bit? Because I know if you're in there, then that definitely has a focus on the physician.
Well, I think the exam gives the high level examples of the things that physician advisors need to really be aware of, both around care coordination and transitions. I think the case studies have actually helped drive some of that into that increased knowledge and renewing that knowledge levels. It is, as And I am a firm believer of this, that we can put all the credentials we want behind our name, but part of what makes us good at what we do, being a physician advisor, a case manager, a physician, a nurse, is our commitment to really being able to communicate and work and realize that the care that we deliver is patient-centered. And so how do we do that better? And I think physician advisors take a very strong commitment in working in that direction. Dr. Chen, am I wrong?
You're absolutely correct. You're absolutely correct. I mean, we like you said, physician advisors, we are part of this process. We are embedded within the system. Um, and we are advocates, we are educators, and we're a resource, and we are there to help. We are there to help. That is the thing that we want to do the most. So if you don't know if that there's a physician advisor in your hospital or you're not sure, ask. Ask and find out. You can ask your chief medical officer, you can ask the director of case management, you can ask your billing and coding department and see if there is one around and how do they function? What do they do? And then if you have some sort of a problem or if you have some sort of a goal that you're trying to accomplish, see if you can join forces with them because like I said, they really can handle a very broad range of requests, and especially when it comes to one of these key areas that we've been talking about. And so, they can really help you with that.
And I'm just going to add, because I know that oftentimes our podcasts go to where we don't even know that they're being listened. But if you are a physician, really consider this role and understand the importance of what that role is. And if you are a hospital, really consider, are my physician advisors, is my team certified for the quality and the safety that we are promoting in this role? And if so, how can I use that? How can I support my hospital and the care to my community by actually sharing that role? Because I do think it is an important role.
And if you want to learn more about what physician advisors do on a very granular and specific level, then I do want to let you know about ABQAURP's 49th annual conference, which is going on September 24th and 25th in Clearwater Beach, Florida at the Sheraton Sand Key Resort. And we have a very large, illustrious group of speakers that will be coming. It's a 2-day conference. One entire day will be devoted to physician advisor topics. But all of the topics are going to be excellent. And we're talking about things like, regulations and transitions of care and policy updates. So patient safety, quality initiatives. So it's a really great conference. And if you really want to learn more about the physician advisors and how they can help your organization, it's a really great conference to attend.
Well, this has been a great conversation, and I want to thank you both for the work that you're doing and creating this certification, to advance quality and transitions of care in the physician advisor role. And I guess that brings us to the end of today's conversation, which won't be the last conversation because I want to hear more about this. So I want to make a huge thank you to Dr. Natasha Chen and Cheri Lattimer for sharing their insights on the evolving role of the physician advisor and the critical connection between quality, utilization, and transitions of care. It's clear that this role sits at the heart of the balancing patient advocacy with system performance. And as the healthcare continues to evolve, its impact will only grow. I mean, that's what I get from this conversation today. And so thanks for joining us on the relay. And if you found this conversation valuable, be sure to subscribe and share it with a colleague. And we'll talk to you next time.